Watch 189. Today I'm gonna show you how to check the vital sign. First we need to do is gather our supply. We need a stethoscope, blood pressure cuff, digital thermometer, a watch, and a disposable gloves, together with disinfection wipes. After that, we need to do the hand washing. So, what is collected during the vital sign measurement? Well, you'll be checking the blood pressure, heart rate, respiratory rate, and a temperature. What is blood pressure? Blood pressure is the force of the blood pushing against the artery walls during contraction and relaxation of the heart. Each time of the heart beats, it pumps blood into the arteries, resulting in the highest blood pressure as the heart contracts. When the heart relaxes, the blood pressure falls. Two numbers are recorded when measuring blood pressure. The higher number, or systolic pressure, refers to the pressure inside the artery when the heart contracts and pumps blood through the body. The lower number, or the diastolic pressure, refers to the pressure inside the artery when the heart is at rest and filling with blood. Both the systolic and diastolic pressure are recorded as mmHg, or millimeters of mercury. This recording represents how high the mercury column in an old-fashioned manual blood pressure device called a mercury manometer or sphygmomanometer is raised by the pressure of the blood. Sure that it's not too loose or too tight. After that, of the valve. Lightly press the stethoscope bell over the brachial artery just below the cuff edge. Rapidly inflate the cuff to 180 mmHg or millimeter for mercury. Release air from the cuff at a moderate rate. Listen with the stethoscope and observe the sphygmomanometer. The first knocking sound or Skoroff-Cough sound is the subject systolic pressure. When the knocking sound disappears, that is the diastolic pressure. The blood pressure IT is 110/70, which is normal. When taking your pulse, using your first and second fingertips, press firmly but gently on the arteries until you feel a pulse. Begin counting the pulse when the clock second hand on the 12. Count your pulse for 60 seconds or for 15 seconds and then multiply by 4 to calculate beats per minute. When counting, do not watch the clock continuously but concentrate on the beats of the pulse. If unsure about your result, ask another person to count for you. If your doctor has ordered you to check your own pulse and you are having difficulty finding it, consult your doctor or nurse for additional instruction. The pulse rate IT is 70 beats for 60 seconds. The respiration rate is the number of the breaths a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths for 1 minute by counting how many times the chest rises. Respiration rates may increase with fever, illness, and other medical conditions. When checking respiration, it is important to also note whether a person has any difficulty breathing. Normal respiration rate for an adult person at rest range from 12 to 16 breaths per minute. The respiration I take is 15 breaths per minute, and which is normal. Taking the temperature, I use auxiliary method under the armpit. Place the tip of the thermometer in the center of the armpit. Tuck your patient's arm closely against their body. Leave the thermometer in place for about 1 minute until you hear the beep. Remove the thermometer and read the temperature. After taking the vital sign, you need to disinfect your things that is not disposable, like the earpiece, the stethoscope, the whole stethoscope, the diaphragm, the digital thermometer. You need to disinfect it before and after taking the vital sign. And that's it. That is the demonstration of the vital signs. Thank you.